Disclaimer, if you are uncomfortable with needles or syringes, please skip the timestamp shown on screen. Either way, please enjoy the video. Have a good day. Why hello there everybody and welcome to my video. Have you ever just been casually performing a high-risk surgery and you think to yourself, man, I wish there was an easier way to check these entrails besides wrestling them with my bare hands? Well, buddy, do I have a solution for you. Medical tools. Since the ancient Egyptians, we as a society have collectively figured out that it's probably a better idea to stick some form of object into somebody to see what's wrong with them, as opposed to our entire hand. So, throughout the decades, we have developed an assortment of different instruments to help us identify and solve a variety of medical ailments that range from the common cold to brain tumors. Now, when talking about great medical prowess that has stood the test of time, one point in history comes to mind, and that is Greek antiquity. Because what we know as modern medicine and Western culture, like many things, primarily stemmed from the Greeks. So for today's video, my overall goal is to look at a variety of different modern medical tools and examine connections they have to Greek antiquity, and maybe even find ancient versions of these tools. But for this, I might need a little bit of help, so I've reached out to the Indiana Medical History Museum to see if I can find someone to give me some spicy new information. And this is where the video goes horribly wrong, because in setting up an interview, a literal freaking pandemic broke out, so that squashed any plans of talking to a professional about this. And you're probably thinking now, oh no, this poor guy, he probably has nothing to show now. Oh, you sweet summer child, you babe wrapped in a cashmere blanket of ignorance, you expect little of me, and I am well prepared to ramble on about this subject on my own for the appropriate amount of time directed in the assignment sheet. I need to calm down. When thinking of somewhere to start, I believe the best place would be with what I think of first when I think of medical tools, and that is the stethoscope. The name stethoscope derives from two Greek words, stethos meaning breast, and skopein meaning to look or observe, which would mean stethoscope means to observe the breast. Now, my dear viewer, I would assume you would know that the stethoscope was not invented until 1816 by René Laennec. Many consider René Laennec's stethoscope to be the first tool of its kind, but I would like to present the proposal that the Greeks did, in fact, have a tool that served the exact same purpose of the stethoscope, and that, of course, is the skill to hear pulses by touching the patient. Now, before you say anything, yes, I realize that this isn't exactly the literal definition of a tool, but I say that if a skill is honed and used masterfully enough by someone, it does indeed become a tool at their disposal. No better example of that would be Galen, ancient medicine's cool guy. Now, I'm not going to get into all the details about who Galen was, because all you need to know is that as a medical professional, Galen was the real deal. Galen was a known master of pulse diagnosis, and was known to be able to diagnose a patient with an ailment just by feeling their pulse. He even wrote on the subject specifically in a treatise entitled De Pulsibus. So with that on the board, let's look at some more conventional examples of tools. Some of the most common instruments used in surgery in modern times are scalpels and hooks. In my opinion, the most interesting factor that these two instruments share is that their purpose and design have practically stayed the same throughout the entirety of history. When observing the designs of a modern scalpel to one from antiquity, there is little to no difference in shape and purpose, with varying sizes depending on where the incision was being made, or hooks being used to lift and pull out pieces of tissue. The only real change that's been made is what they're made out of. Most medical tools from antiquity were made out of iron, bronze, or stone, while pretty much all medical tools nowadays are comprised of inox, which in layman's terms is stainless steel. Now, here's another commonly used modern medical tool that I found to be used in antiquity. This one actually quite surprised me. The syringe, or as they called it, the pulkos, aka the pus puller. The first pulkos was created by the Stethoscope of Alexandria around 280 BC. Stethoscope was a prominent Greek physicist and inventor. He is credited as discovering the elasticity of air, as most of his inventions involve some sort of air compression or hydraulic system. His most famous invention would be improvements on the clepsydra, which is a clock that measures time by the weight and flow of water. Now, back to pulcos. They were mainly used, like their name suggests, to extract pus and bile from different body parts and wounds. Currently, we do not have a surviving example of pulcos from Greek or Rome, but we do know that they existed because of the countless accounts of the device being used by many medical professionals at the time, including Galen. They appeared to be made out of brass, and on screen is a simple 3D recreation of what it looked like. Wait, hold on, what's that I hear? You're saying that the word pulcos sounds nothing like the word syringe, and you want to know where the word came from? Well, first of all, that was incredibly rude of you to interrupt me, and I do not appreciate it. Second of all, the name syringe actually derives from an Old English word from medieval Latin, syrinx, which means pipe or channel. It means pipe flute. It's because it looked like a pipe flute. Next, we have a tool that's called an aspirator. An aspirator is basically a medical vacuum and is used to remove unwanted substances during a medical process by suction. The name aspirator derives from the Latin words ad, which means to, and spirare, which means breathe. So aspirator means to breathe. Now, with the research I've done, I've concluded that these oddly shaped cupping vessels serve the same purpose. How these worked is that due to the shape, when heated, provided a temporary vacuum that when placed on a portion of the body, would suck the skin right up. This process was mainly used for extracting bad blood or pus. If this process seems familiar to any of you, it's because this technique is actually still used today and is seen as a unique type of therapeutic massage. Now, as we're moving on, we're getting into what I would like to call the oof territory of medical tools that are just perfectly fine and comfortable to use in modern times, but back in antiquity, I think it's safe to say that these were basically mild forms of torture with medical benefits. One of these particularly torturous devices is a catheter. A modern catheter is a rubbery hollow tube that enters your urethra and enters your bladder. Catheter's root word is a catheter. Very original, I know, which basically translates to let down, which indicates a catheter's purpose. Its job is to help people drain their bladder if they are unable to relieve themselves for any multitude of reasons. Now, if that makes you cringe just on its own, well, be prepared because, we have a nightmare. Here is an example of what the devices looked like in antiquity. Catheters were made of metal and were completely hollow. There was a difference on what type of catheter was used between a man and a woman, too. The short, straight one was used for a woman, while the longer, curvy, S-shaped one was for men. Now, I have read so many articles and textbooks covering these specific catheters, and disappointing as it sounds, I have yet to find any conclusive, backed-up reason as to why the males are all curvy like this. I can assume because the man's urinary tract is longer, but the only conclusion I can make as to why it has such an odd shape is some sort of misunderstanding of the male anatomy. Because, good lord, these things could reach to almost 12 inches. Just thinking about it makes me want to cry. Moving on, I'd like to end this video off with a doozy, so I would like to present to you all a speculum. For those of you who don't know what a speculum is, its main purpose is to hold and gape open body orifices for examination. The speculum's root word specula translates in Latin to mean to look, like its usage suggests. A speculum is mainly used by gynecologists when performing vaginal exams to hold open the walls of the vagina to examine it and the cervix. As you can see, it's made with the smooth, soft stainless steel to keep whatever pain it might cause at a minimum. Alright, now cut the music. I'd like you to just look at our modern instrument for a second and let it just marinate on what it looks like. You can close your eyes if you need to and really think about what this is used for. I just want you to think about it for an extra second longer. Okay, now ready? Now take a look at the absolute monster that they use in antiquity. Look at this and tell me it doesn't make you want to become a feminist after imagining what this does. Like, good lord. This vaginal speculum is often labeled as one of the most complex tools in ancient Greece, and many doctors who used this device had to be well versed in engineering in order to work its many moving parts. Despite the complexity, vaginal speculums were the most popular devices used by physicians in the examinations of the vagina. Despite this, it is one of the rarest surviving medical instruments in Greek antiquity. A speculatory reason being the bronze of these devices were most likely recycled for other uses, as sadly this seems to be the case for a large portion of ancient artifacts. Now, in conclusion, I think it's pretty self-evident to say that medical tools have always been one of the most important parts of the medical field throughout history, and as technology steadily improves, new, more efficient instruments are being created on the regular to help improve and maintain our society's health. But I hope what I've shown today that incredible things always start with humble beginnings, and that sometimes you just can't beat the classics. Except for the catheters or speculums, don't include them in that statement.